Hello and welcome. I'm Steve Clemens, editor-at-large of The Hill. Thanks for joining us today for an important subject: mental health, addiction, and the COVID-19 pandemic. We're going to be taking a look at the physical and mental challenges posed by the pandemic and examining what solutions are needed now and in the future for a much healthier country. Before we begin, I'd like to thank our sponsor, The Hartford, for its support of today's event. Over the past year, stress and anxiety have taken an unprecedented toll on our citizens' mental health. And in the shadow of the pandemic, the opioid epidemic has really gathered speed. As we grapple with these challenges, workers everywhere are feeling a lot more pressure than they were before this pandemic. Stigma around issues of mental health and substance use disorders often prevent people from seeking help. How are we addressing the worsening crises of mental health and opioid use? What is the role of employers in ensuring a healthy and stable workforce? And how can leaders put in place solutions that tackle these issues and the stigma surrounding them? We've got a fantastic lineup of speakers to answer these questions and more, including leading public officials, members of Congress, and treatment experts. But first, a few housekeeping notes. You can tweet us at The Hill Events using the hashtag #TheHillMentalHealth. We're broadcasting live and we'll be taking your questions throughout the program. As with any live stream, you could experience occasional trouble with the video. Refreshing the page, they say, in most cases will fix the problem. Good luck with that. Joining us now is Congressman John Katko of New York, co-chair of both the Bipartisan Mental Health Caucus and its Suicide Prevention Task Force. He is author of 3 mental health bills that passed in the House last month. Congressman, it's great to see you. Let me just repeat that. You passed 3 mental health bills in a Congress that Republicans don't have. So first of all, congratulations on that. But secondly, tell us what you have passed and what the partisan temperature has been around these important issues you've been trying to raise.
Well, all of the bills I have passed dealt with various aspects of the mental health crisis in this country. And it's just a matter of getting bipartisan support for those bills and to work in a bipartisan manner. I mean, to me, mental health is a quintessentially bipartisan issue. When you really think about it in this country, the number 2 cause of death, think about this, the number 2 cause of death for kids 10 to 24 years old is suicide. The number 10 cause of death for all Americans is suicide. And we simply do not prioritize it the way we should. And so my goal is to take bite-sized chunks and work on specific issues to continue to try and get bills passed and bring awareness to this issue. And I will give you one last statistic so we can set the table for this discussion. For every suicide in this country, there's 29 attempts. And every hour in this country, there are 5 suicides that have gone to completion. And for all 5 of those, there's 29 times 5 that have been attempted. So every day in this country, literally thousands of people attempt to take their lives. And if you look at it from a funding standpoint and a research standpoint, we have nowhere near the prioritization that we should have in this country for mental health in general and suicide in particular.
No, thank you, Congressman. You have laid out, let me just go through this way. You have the Suicide Prevention Lifeline Improvement Act. We have the Mental Health Services for Students Act. We have the Pursuing Equity in Mental Health Care Act. Now, I just spent a bit of the weekend talking to a senior official from a state in the Appalachian region, and this legislator shared with me that one of his concerns about a lot of the money that we have sent and we've shared with Americans who are struggling under this pandemic is it hasn't taken account that a lot of people are struggling with addiction. They're struggling with how to make it. And what we have inadvertently done is created a pathway for more purchases, of more of this. So I'm just wondering, with the infrastructure that we have on mental health, helping people that have these dependencies right now, is there enough? Because this person's comment was, we're nowhere near where we need to be in dealing with opioids and other forms of parts of that ecosystem of mental health.
That person is absolutely 100% right. Like I said earlier, we don't prioritize mental health in this country the way we should. Perhaps there's a stigmatization attached to it. I don't know. But if you think about what's going on in the pandemic, is you have kids that have been polled nationwide, 20 to 25% at least of the children, and probably a higher percentage, have had suicide ideations since the pandemic began and the isolation took root. And if you also look at the fact that heroin addiction and heroin overdose deaths are on the rise during the pandemic, that's not a coincidence, because a lot of people that are using heroin are self-medicating to mask mental health issues. And then to compound that issue, you have drugs coming across the border in record numbers, especially fentanyl. And fentanyl seizures are up already this year, more than all of last year. And last year was a record number. And there's been enough fentanyl seized at the border already this year to kill every single man, woman, and child in the United States of America several times over. That is a stunning statistic, and it's a crisis that has really been exacerbated during the course of the pandemic, no question about it.
What is missing in the picture? Do you see states and local governments equipped with what they need? I know we're talking about what's happening at the federal level, but when you kind of look broadly at the community and the broad part, look, I spent a lot of time in the Eastern Shore of Maryland. I actually see very impressive heroes working a lot of levels, trying to work with very few resources to help on this front. But I'm just interested, if you were to kind of have more in this area, how could we, get better partnerships, and how could we reach people where they are? And as you said, just kind of knock out this stigma issue in a way that gets people to feel like they can come back in a healthy way and come back to being embraced rather than left on the sidelines.
Right. Well, there's a lot of questions. We could talk for 3 hours about this issue, but the bottom line is the resources aren't there. And in my local community, we did a mental health task force when I first got into Congress, and I hooked up with a Democratic assemblyman from New York State. And what we revealed was New York State has got a few really good medical center hubs, and one of them. We have an upstate medical university. We have Krause Hospital. We have St. Joe's. We have Community Hospital. We have a lot of, and then we have a huge medical school here. The bottom line is we have a mental health shortage in Syracuse of practitioners, especially in the pediatric realm. They didn't even have an inpatient unit for pediatric mental health in Syracuse. And parents had to drive sometimes 2 hours away just to get their kids' mental health treatment. So just having the facilities and the physical structure in place, we've improved since I got into Congress, but we got a long way to go in Syracuse, but also in this country. I'll give you another example. A kid I met at this 72-hour emergency psychiatric unit up at St. Joseph's Hospital years ago, and it profoundly struck me. He was in and out of that place 20 times in the last several years, always in crisis. They stabilized and they let him out. No follow-up whatsoever. No follow-up mental health treatment. Sparse practitioners available. Sometimes the waiting list is months to see a practitioner. Those are the types of things that we got to change. So I've done everything from introduce bills to incentivize people to go into the mental health field by getting their student loans repaid, to incentivizing Medicare patients during the course of the pandemic to be allowed to have mental health counseling over the telephone, because a lot of them don't have access to the internet. So there's a broad range of issues we need to deal with. And we have to understand that this really is a crisis that requires a crisis-like response. And if you look at like the National Institutes of Health, if you look how much money is being spent every year for AIDS research and prevention, it's unbelievably high. Well, it should be, and I don't begrudge it at all. But if you want to look at a proportional impact on society, mental health issues are much more substantial than anything AIDS could have been, and AIDS was substantial in and of itself. So if we treat this like a disease, which it is, mental health, and really put the dollars and cents into researching the issue and understanding its calamitous effect on our society and our economy, perhaps then we could start turning the corner. But we really need to prioritize it. And that's what my mission's been since I've been into Congress.
John, there's another area of this topic, which is a lot of our nation's veterans also suffer from mental. You can look at every quadrant of America, but veterans are an important part of this. And I'm just wondering that as you look at the Biden administration 6 months in now, is the Veterans Administration, is HHS, are they doing and creating the campaigns and priorities you think are important for this? I mean, I know it may be too early to judge, but do you see from them a priority on this and reaching their constituents and communities in a way that you feel is where it should be?
From the veteran side of things, I think they're continuing what we started in the previous administration. That was really trying to get a handle on the mental health aspect of the military and understanding that almost every hour in this country, 22 times a day, a veteran will commit suicide. When I first got into Congress, they had a suicide lifeline, or you could call it like a 911 type for veterans. And you would be placed on hold, or you would be told to leave a message. And oftentimes, unfortunately, the military veterans ended up taking their life before they spoke to a practitioner. And the statistics are clear that if you can get to somebody and speak to a practitioner, oftentimes they will not go through with the suicide. So it's imperative that we have the practitioners in the veterans field. Getting better, there's still a long way to go, but in the veterans arena at least, there's a heck of a lot more discussion about mental health in general and PTSD in particular. And there's been a lot of innovative approaches to how to deal with it. And from medical marijuana use on down. And I applaud the creativity in trying to get help to these veterans. Again, I sound like a broken drum, but I want a broken record, but I want to, we need more resources for them as well.
Well, Congressman John Katko is ranking member of the House Homeland Security Committee, and he's co-chair of the Mental Health Caucus and the House Suicide Prevention Task Force. We're really grateful for what you're doing out there and prioritizing it. I think everyone has a story. If you think about this, and I was going to ask you, why are you investing so much in this? I'm sure you have personal reasons to. I have personal reasons in my family and world why it's so important. I think many people, if they scratch beneath the surface, will understand why this is such an important issue. Thank you so much for joining us.
Thank you.
My next guest is Dr. Rachel Levine, Assistant Secretary for Health at the Department of Health and Human Services. She's previously served as Physician General and Secretary of Health for Pennsylvania. She's a doctor. She's cool. We've had such great conversations in the past. Dr. Secretary, Assistant Secretary Levine, first of all, happy Pride. But second, I know this is a big issue. And I want to start out just at a human level. And as I've thought about the pandemic, and you think about the stress that has happened in so many communities in this country, which has exacerbated underlying conditions that maybe we weren't tending to well enough before. I know it's an unfair question, but what are the things we can do to change the vector for the people in need?
Well, thank you very much for your introduction. I'm so pleased to be here. I think you're exactly right. I mean, the pandemic has certainly shown the level and depth of the health disparities that we see in our nation. And that includes physical health, but it also includes mental health and substance use disorders. And so we need to address this really at a department-wide level. And that's what we're doing under the leadership of Secretary Becerra.
I early in the pandemic, I interviewed Francis Suarez. He's the mayor of Miami, and he shared with me, he said, Steve, people may be talking about working at home, but he said the family stress, the interpersonal stress, the stress of not with children and what's going on, then you may have people with underlying conditions. And we've kind of talking about workplace dimensions, and sometimes, workplaces can be stressful. Sometimes they can be a needed part of one's social functioning. And we've just seen the workplace move from buildings like I'm in now into, online. Are there any playbooks on how to sort that out? If you're an employer and you want to partner with those resources out there in this new environment that's gone, 99% digital, are there things that you see, either when you were in Pennsylvania or now when you have these federal national responsibilities that would help workers and help employers in some of the stresses they're experiencing?
Well, you're exactly right. There have been so many stressors during the pandemic, including illness, grief, job loss, changes in jobs, as you said, loss of routines, food instability. And it is an unprecedented situation. So, of course, with this novel pandemic and the greatest pandemic that we have seen, the largest pandemic that we have seen in 102 years, I'm afraid there is no playbook. But I think that there are some lessons learned from the pandemic. One is that we are all interconnected. And I think that's an important lesson. Second, of course, is the importance of public health. And the third, I think, is the importance of mental health. I think that what employers can do is, one, to talk to their workers, to talk to their employees, and to survey them and hear what they're saying on an individual basis and on a collective basis, and to go slow. I think that trying to make abrupt changes, for instance, everyone has to come to work in the next week or so, will increase the anxiety and the challenges that their employees are having. So I think communication is so important, and going in a slow and steady pace.
Rachel, let me ask you another question. I think sometimes we have a little bit of hypocrisy baked in to our institutions and our own lives. And what I mean by that, I've worked for places in the past that focused on mental health, raised the issues in an editorially important way, but not this place. We won't get into that. But when they encountered someone who attended an event or who they encountered who had mental health challenges, they behave like everyone, like many others do. They did very little help. They kind of did anything. That's why I become a fan of what's called mental health first aid, which the National Council on Behavioral Health has tried to spread around the country, just to try to create awareness on how to be helpful, how to have empathy, how to do it. But I think we all talk the talk of trying to be responsive and help, but I think many people don't know how to walk the walk. And again, with your experience in this, are there elements of empathy? Are there elements of understanding this that allows people to kind of walk in this person's shoes who's having these challenges and to be more support as to being part of the problem?
Well, I think you're entirely correct. I think that stigma, driven by stereotypes that people have about mental illness and about substance use disorders, both from thinking about groups of people, but also sometimes individual people, their individual employees, or even family members, is really challenging. I think it goes back sometimes to fears that people fear what they don't understand. What is beyond their experience. And I think that that type of fear can lead to these type of challenges that you're talking about. So I think the way we address that is through education, both just in terms of the facts about things, but also this empathic education that you're talking about. I think that we can do that from a public health perspective, and that's what we're going to try to do at HHS.
Another thing, Congressman John Katko just shared an alarming statistic that I didn't realize. He said for every suicide, every person who commits suicide, there are 29 attempts at that. We have data that show that 1 in 4 young adults has contemplated suicide. We have the Trevor Project. You just tweeted this out in your Twitter feed. You said, where the Trevor Project said that 42% of LGBTQ youth seriously considered attempting suicide, and more than half of trans or non-binary youth. And you were alarmed by this. I mean, I think all of it's alarming. I did not realize that this challenge was as high as it was during this past year. I knew it was bad. I mean, honestly, I just want to throw my hands up. What can we do?
Well, we're going to need to address this in a systemic way across the administration and across Health and Human Services. So, first, the American Rescue Plan included $4 billion to expand access to mental health service treatment and substance use treatment. The Rescue Plan Act also included $30 million for harm reduction services. That's like syringe service programs. In addition, Secretary Becerra and Acting Secretary Tom Coderre of SAMHSA announced Community Mental Health Service Block Grant of $1.5 billion and another substance use prevention and treatment block grant of $1.5 billion, not $1 million, $1 billion with a B. At HHS, the Secretary has revitalized the Behavioral Health Coordinating Council. And so we're going to be looking across the department, all of the different divisions at this issue, including a specific subcommittee on suicide. You're right. There are a number of different aspects of this. There's suicidal thought or ideation. There's suicide attempts and then tragically completed suicides. We need to look at all aspects of prevention, primary prevention in terms of suicidal ideation in the first place, and then secondary and then tertiary prevention dealing with people who've attempted suicide but not completed it, and then work to treat them as well.
All right, Rachel, let me just ask you finally, I've got Congressman Dave Joyce coming on shortly. I've interviewed Rob Portman, Senator Portman, Senator Whitehouse, others on this kind of broad issue of both mental health and opioids and how do we do it. And one of the things that comes up every once in a while is a sense that the administration, whether it's the last administration or the Biden administration, is uncoordinated when it comes to things like large-scale waivers to help create kind of a blanket use of opioid abuse or opioid addiction drugs and others. And I'm wondering, do you think you're in a place now, given your background, given where you are, to help coordinate this response inside the administration? And do you think we need something like a White House conference on mental health in the country to help draw in? Because I have to tell you, it's one of the few areas right now I sense a lot of bipartisan support. Maybe that would be good for the country. But just wondering if you're in the right place and the secretary is in the right place to help drive some of these coordination questions which constantly come up.
I think we're in a very good place in terms of coordination. These mental health and substance use disorder challenges are absolutely a priority for President Biden. They are a priority for Secretary Becerra. And I think that this revitalization of the Behavioral Health Coordinating Council will be very, very important. I've been working on these issues my entire career, both in academic medicine and then as the Physician General and Secretary of Health of Pennsylvania. And I really see that we have the team and we have the system in place at HHS and across the administration to deal with these issues.
Well, Dr. Rachel Levine, Assistant Secretary of Health in the Department of Health and Human Services, former Secretary of Health in the state of Pennsylvania. Great to see you again. I look forward to seeing you for real in town soon. So welcome to Washington, and thank you so much for joining us today.
Thank you very much. It was a pleasure to be here.
Joining me now is Congressman Dave Joyce from Ohio, a state that has been hit particularly hard by the opioid epidemic. He's the vice chair of the Congressional Addiction Treatment and Recovery Caucus. Congressman Joyce, it's great to see you, and I know that this issue is a very, very big one for you. And, I saw your tweet where you said 40 plus states have reported an increase in opioid-related deaths during the pandemic. And you kind of lay out something I've been getting at. A lot of these issues were underlying before, and the pandemic has come on and just aggravated them more. As you kind of look at the dashboard of what our collective response is, what does the private sector need to do? What does the government need to do? What do states need to do? What's on that dashboard for you?
Well, thank you very much for hosting this, Steve. I think it's very important that we have these discussions. If you don't mind, I might touch base a little bit on what you were talking about, Dr. Levine, before.
Sure.
I don't know if nationalizing the idea for help is going to help. I really found that during the pandemic and being at home among people, just having that contact, just having that ability to get online or get on the phone and talk to people. I mean, it doesn't do us any good, whether it's opioids or mental health issues, to have somebody realize that maybe they need to take that first step and get help and then get told that they need to wait 30 days. I think we have to make those things more accessible and be sensitive to the fact that that's a big step for anybody to take. And, I think one of our jobs is very deliberate, is making sure that we get money into the communities that are having to deal with this at that also local level. The police department, the first responders, the mental health facilities, the treatment facilities, because it's an every hand on deck approach, when we're trying to get these things accomplished. And what we can do here is help facilitate the money. As Dr. pointed out, there's been money made available in the different acts that have passed through since the pandemic and prior to that. But it's important that we continue to stay on top of this and continue to take care of those people at home who have to deal with this on a day in, day out basis. My first letter to the White House in May of 2020 was talking about just watching the unfortunate stats increase. We finally had a decline in the opioid deaths and overdoses. And all of a sudden, this uptick that continued, unfortunately, was exacerbated by the pandemic. That sense of loneliness, sense of being without a job or without a future. They turn to things to relieve that inner pain, that mental pain. And so I think it's important that we continue to stay on that and take care of those folks at home and be able to, especially as employers, create the foundation that people will understand that coming out and talking about these things is not going to be held against them. Matter of fact, a lot of folks will say once treated, they were a better employer and or employee, and the employer will say they're a better employee too because they got that off their back.
Congressman, I know that you're looking at workplaces, you're looking at a lot of things, but you're in Congress. But I know that they're the underwriter of today, and unrelated to that, the Hartford actually did a study that showed, upwards of above 70% or so of employers thought they were stepping forward on mental health, that they had created an environment that was removing, that had removed stigma, that get people to open up. But then when you poll those workers, only 30-40% of them sort of felt that openness. I'm just interested, I know the federal government, and we all know that the federal government is limited in what it can do, but in providing hotlines or setting messages or setting tones or, raising some of these questions in a way, again, I try to raise this with Dr. Levine, where I see a lot of well-meaning people out there who just don't have the apparatus to know how to deal with people who are suffering. I guess, my real question is, what can we do with employers to help them bridge that gap? And what can the federal government do by way of, talking to John Katko about suicide hotlines and other elements of that picture that we still need to do a lot more?
One thing, Steve, that I would not have been necessarily a sponsor of prior to the pandemic was the idea that broadband would be considered part of infrastructure. I certainly believe that now. Because that's one thing we did notice, as I was talking about before, the ability for people to reach out and touch someone, through the VA or other mental health facilities or addiction facilities, just to have that contact with folks. And so in setting up places where, that 15 minutes of walking somebody through is, hey, things aren't that bad. Hey, why don't you call me and I'm going to send you some information on where to find jobs. There's a lot of jobs that are available or help available, and I'm here for you, and call back. That kind of just, reaching out and touching folks, which is so important at the ground level, is something that I think needs to continue to be done by us. And, what I noticed, obviously, when you go by a McDonald's that was closed, but the parking lot was full, the people were all there using the internet, that it was a big problem in my district as well. And you wouldn't necessarily think it in, Ohio, Pennsylvania area, but obviously it's something that needs to be addressed. Just having the ability for people to reach out and contact. That telehealth and telemedicine is something that can only be established by us putting the money to broadband and taking it out that extra, or the last mile, as they say, and then using some of our parental pressure, if you will, on corporations to make sure that the broadband that we laid at our expense is brought into that house in a cost-effective manner.
Congressman, you're working hard to pass a piece of legislation called COPE, Comprehensive Opioid Protection Act. What would COPE do?
Thanks for bringing that up. It's important. The idea of COPE was to give those people, as I was talking about, on the ground, the ability to deal with this. Unfortunately, a lot of communities started to see their revenues slip away. And so we don't want them cutting things. We want people to be able to understand, law enforcement to be able to stand, they'll have the wherewithal to do the job and to get folks to come forward and be able to be part of, what we're trying to do here and getting them better, getting them healthy. And I think it's just so important that, when it comes to the COPE Act, that we continue to do the things that are necessary as far as getting in a bipartisan way, getting help to those folks and letting them understand that the COPE Act will bring the necessary funding and help those people on the ground get the education and the training that they need. In my days as a county prosecutor, I can tell you, 25 years of doing it, we saw a change where people, there was no longer the mental health facilities we had in days of old. And unfortunately, our local jails and our prisons became mental health facilities and not doing a very good job at it. So, and a lot of that leads to addiction and the problems that are come with that. So the COPE will allow us to educate those folks back at home and how to use the system in a meaningful way and help those people who need help.
One of the things the Trump administration did, I don't know if a lot of people remember this, the many, kind of fireworks of the last 4 years, but the Trump administration invested heavily in opioid abuse and trying to respond to that. I remember interviewing Kellyanne Conway. We have Jim Carroll, the former director of the Office of National Drug Control Policy, on the program here with us later today. Has there been continuity between what they did and the investments they were trying to make around the nation in the service and support centers? Or do you think the Biden administration is moving in a different direction? And just what guidance would you like to give the Biden administration in terms of approaching this challenge, from the position of the White House?
I go back to my father, and he told me that when being a World War II vet who was shot and left for dead, they didn't talk about it much. And he said they got through because they came home and they went to work. And they got jobs. They used the GI Bill, went to school, went to work. And that there was a certain camaraderie about that they were creating this new world and things were going good in the country. And things were going very well prior to the pandemic. I think, unfortunately for President Biden, he's inherited an economy where things started to slip. And when people don't have a job, they don't have the wherewithal to get out every day and be in their communities and being active and paying for the things that are necessary for them and their family. That sense of depression or loneliness that, and especially if one was single and didn't have a family to reach out to, that angst continues to build up, and that leads to either for those who may have been having some instability problems, more mental health problems, or drug addiction too. So I think obviously we need to continue to build on what we're doing and having a strong economy with full employment, getting people the opportunities to work and stay active and be part of something bigger than themselves is an important part of helping cure this, and having employers on board. And I haven't spoken to one employer yet who hasn't thought about ways that they can be helpful or what they can do, understanding that the unfortunate stigma that's around either drug addiction or mental health issues is something that we got to pierce through. And we have to do it in a way that realize that there's nothing wrong with somebody. I have heart issues. I take statin. People have other issues and they take medicine for that. It just is what it is. I got this from my mom. So, you just got to work through some of these things and try to get it in a way that lightens up the conversation, that, just because you're having some mental hiccup or an issue at the moment doesn't change that you're still a very good person.
Dave, just real quick. I mean, I asked Congressman Kotko, I said, everybody has a kind of story in this realm around them. And I worked in the Senate, as a staffer, and I know storytelling is important, at some level. But I mean, are you invested in this because you yourself have also had personal connection to this? Is that what you share with your colleagues in terms of having them understand the importance of these pieces of legislation and your work here?
Steve, the mental health aspect of this I saw where so many repeat offenders were coming back in. And when they were on their medication, they were doing fine. The trouble is, they get fined and they don't feel like they have to take a medication anymore. And, over 25 years, you get to see a lot of the same characters. And so the drug court that they established in Geauga County, it went back, their first graduate, the guy went back so far. Hell, I was his public defender. And then I was a prosecutor. I knew his father, I knew his whole family. And it took 20 some odd years for this kid to finally get on the straight and narrow. But having people stand there and having the apparatuses in place for them to do that are very important. I've watched my kids' friends, unfortunately addicted, and a couple of them pass away. My wife's nephew passed away from overdoses. They were all good kids, just got caught in a bad situation that was bigger than them. And the drug itself must be like the devil itself, because it certainly, we found something that actually breaks maternal bonds. So it's got to be hell for anybody who gets addicted to it to try to get themselves off. So I think we have, from law enforcement, again, we try to arrest our way out of some problems, and that's not the treatment for opioids or mental health. We have to understand and work with the problems and realize that, unlike alcohol, where it was a 28-day program and then all of a sudden, boom, back to work all is well, that's not the same here. This is a really long-term problem with opioids, and God forbid they, in their chase of opioids, end up with fentanyl, because what they took one Friday, the next Friday may kill them.
Yeah, well, that's absolutely right. Representative Dave Joyce, Vice Chair of the Addiction Treatment and Recovery Caucus in Congress from Ohio. I really appreciate your candor and thoughtfulness in dealing on this topic. Thanks so much for joining us today.
Steve, thanks for doing this. It's a very important thing that you're doing here, and keep on doing it for us.
Thank you, sir. And now for a message from our sponsor, The Hartford. Please welcome Lori Goldterman, CEO of Aon's U.S. Commercial Risk and Health Business, and Chris Swift, Chairman and CEO of The Hartford.
Hi, I'm Lori Goldterman, CEO of Aon's U.S. Commercial Risk and Health Business, and I'm really pleased today to be speaking with a colleague and a friend, Chris Swift, who's the Chairman and CEO of The Hartford. Thanks for sponsoring the conversation today, Chris. I know at Hartford, you're a strong advocate for mental health and the stigma of addiction, which we are all facing today, a rise in both related to the pandemic.
Thank you, Lori, and it's great to be with you. And thank you so much for sharing the stage today. As you know, the Hartford is a leading workers' comp and disability insurer, and we like to say we're in the business of underwriting human achievement, helping thousands of U.S. workers each year return to active, productive lives after an injury or an illness. And we know from many decades of our experience that untreated mental health conditions and addictions prevent many Americans from living full, healthy lives. And over the past 14 months, there has been a startling increase in addiction and mental health challenges, principally due to the environment that we were living, where there was significant loss of life, social isolation, economic hardships, and the racial inequality that came to the forefront. So as we sit here today, Lori, I'm proud to say that we've partnered with NAMI, the National Alliance on Mental Illness, and really they call it an epidemic within a pandemic. And we also know from our own research that we announced today that more working Americans are dealing with mental health challenges such as anxiety and depression than ever more in the past. And we're here ultimately to shine a light on this and talk about it. So again, thank you for joining us today.
Well, and it's been an unbelievable past year and a half. I mean, I don't think any of us could look back and have thought we would go through all the different hurdles that we faced. Our families we've been apart from for so long. Many of us are missing that work environment with our colleagues' interaction. And even though the two of us have been on airplanes a lot, this working from home, I think we've never worked with more intensity or such long hours. These are truly unprecedented, challenging times, Chris.
Yeah, completely agree. And I would say, many employers are reporting increased stress and anxiety over the past year, and with all their employee base, no matter what part of the country you're in, whether you're working at home or you're working in the office, it has been a very stressful and anxiety-based period of time. In fact, 70% of employers that we polled say that they do now recognize that their employees are suffering with significant mental health challenges, and it's becoming more of a workplace issue. Also, 52% of those employers said that they're experiencing a significant or severe workplace issue due to substance misuse or addiction amongst their employees. So these are real life conditions that we face today, Lori.
It's just incredible the numbers that you've cited. I would say mental health is the number one conversation our corporate employers are wanting to have a conversation. And your statistic in your report, mental health is among the top 5 reasons for U.S. workers to file a short-term disability claim. And 72% of employers say stigma prevents treatment. So when you think about, this is something that if we can change the culture around the word stigma, people are afraid to bring it forward. And this is where I think we can make such a difference. I'd be curious, your thoughts on just how we can start to drive this change and how stigma impacts that.
Sure. Well, as I said, we have one great partner in NAMI. We also have another great partner in Shatterproof, who's also a Connecticut-based organization really focused on the opioid addiction and really preventing it. And both of those organizations talk about the power of stigma in not enabling people to get the treatment that they need. So again, it's a real workplace issue. It's a real home issue to really destigmatize both addiction and mental health. And there are real costs associated with mental health. In fact, NAMI estimates that untreated mental health illness here in the U.S. costs the U.S. economy about $300 billion annually due to lost productivity, absenteeism, turnover, and increases in medical and disability costs. In our own research, 1/3 of U.S. employers say that strain on workforce mental health is having a severe or significant financial impact on their company. So it's a real business issue. It's a real health issue also, Lori.
And the dollar amount, $300 billion, is staggering. And I think, we all have probably benefit plans that have that employee assistance program, but this past year, those were explosive. In fact, in many cases, when you needed to get those services, it was really hard to find the capacity of enough people to help those dealing with mental health illness or addiction. And you start to think about, is there a business case here to tackle this stigma and to encourage treatment? Should employers really take this on, not just for the good of their employees' health, but the business case around this issue is significant.
Well, I think you're absolutely right. Reducing stigma in the workplace is paramount to improving the lives of Americans and our employees, right? This is a workforce issue. It's a productivity issue, and there's a business case to be made for making investments in programs, to generate that return on an investment, which ultimately, translates into higher sales, stronger margins, lower absenteeism. So I'm urging all business leaders, across the nation to continue to prioritize Americans' mental health by fostering a stigma-free culture that removes hurdles of stigma for those needing treatment, and allowing them to more easily seek that treatment, have the confidence to seek the treatment, to get on the journey of returning to health and productivity, because it is going to take time. These issues are not a quick fix, and we need to be encouraging as business leaders.
Well, the only way to move the needle is to bring those public health leaders and policy makers together. And the insights today have really been helpful, I think, to this conversation. There's no question. And why do you think, Chris, it is important to engage the public policy on topics that we're discussing today?
Well, I think we've got good history lessons here. When public and private sectors come together to work on solution, magic really happens. I could point to the opioid addiction issues that we've been very vocal on over the last 5, 6, 7 years. And again, the private sector, public sector came together to really reduce addiction and destigmatize a lot of the language associated with that. So I think the realistic issue is a lot of these matters aren't partisan issues, which is good these days when something's not partisan to make progress. And we met with both lawmakers on both sides of the aisle, and I think there's a great sense of urgency to get after some of the mental health conditions that we face today. Prior administrations have supported mental health with funding. I suspect this current administration will also look to increase funding and ultimately treatment for people going forward. So I think that's the power of the private and the public sector coming together, and all parties could contribute to doing good. I would just say in wrapping up, Lori, though, that we're also heartened by another finding in our survey that the majority of employers and U.S. workers think that mental health will become less stigmatized in the workplace as a result of the pandemic. It's actually freeing up in more discussion. So we hope this is true. We're encouraging it in our own actions as an organization, and that will be powerful in and by itself. So we know how
that's where it starts. That culture of stigma-free environment, and Hartford is such an amazing leader in workers' comp and disability, and you're such a strong leader in our industry. I'm proud to be part of Hartford study in promoting mental health and a stigma-free culture. So thank you.
Well, the feelings are very much mutual. I known you many, many years. I have a high degree of respect for your firm and the advice that you do provide to your clients in these areas as a health provider, as a benefits provider. So my hat's off to you to continue to do the good work in helping all Americans return to mental health.
Thanks so much.
Thank you to Chris and Lori. And I should say, just a quick editorial, I hope Chris is right and that Gravity is taking us a good direction on stigma-free environments. I am more skeptical, and I think it's going to take a lot more work, but that's why we have this great panel of experts to sort some of this out. Dan Gillison is the CEO of the National Alliance on Mental Illness, the nation's largest grassroots mental health organization. Dan, it's great having you here. Courtney Hunter is Vice President of State Policy at Shatterproof, and we just heard a bit of Shatterproof, where she works to engage policymakers to eliminate barriers to addiction treatment. Dr. David Fullen is the director of the Yale School of Medicine's program in addiction medicine. The program works to improve and expand access to prevention and treatment services and substance abuse. And Jim Carroll, whom I mentioned just a short while ago, is the former director of the Office of National Drug Control Policy. Welcome to all of you. Thank you. Well, Dan, let me just start with you for a minute and help maybe set the stage. You wrote an op-ed for us, and thank you for that, in The Hill, that looked at, where you were advocating that we needed to have, so 988 crisis response, a promise in peril, and kind of looking at how we need to reimagine our response to this crisis, which we've been discussing today. Can you give us the highlights of that, and can you help us open the door on what the most important priorities are in dealing with? I mean, we have got Jim on, and under his tenure, we had a drop in at least opioid-related deaths. I know the picture is much bigger that we're talking about, but there's just no way around the fact that the pandemic's been horrible for America, and mental health challenges are perhaps higher than we've seen in generations. So, what's your recommendation of what we need to focus on?
Yeah, thank you, Steve, and good afternoon or good midday to everyone. In terms of the focus, and you brought it up, you raised and teed it up perfectly from the standpoint of 988. If you look at where we are, this is an inflection point. The demand for mental health services was tremendous before COVID, and the supply of resources was limited. So that demand has gone up as we've been living in isolation and have seen some of the things that have occurred in terms of the COVID. So 988, what is 988? To realize 988, first of all, it's a transformative opportunity for us from the standpoint of right now we have 911. If there is a person in a mental health crisis, the number that a family member calls is 911. Oftentimes you get the wrong type of response. You get a law enforcement response when you want a mental health response. And neither organization or neither area wants that. So the 988 number will provide the following. It will provide a 3-digit number for either national. It is going to replace the 10-digit National Suicide Prevention number. So it will replace that. And it's also going to be for a mental health crisis response. So a member in a community, if they have a loved one that's having a mental health crisis, the number that will be called is 988. The realization is that, or the opportunity for the realization is that when you call that number, you'll get a mental health response. Now, that is something that we see that will go operational in July of 2022. When we say operational, there's a lot of work that has to happen for that to actually be realized, meaning that on the front end, we don't have enough resources to actually stand it up. And on the back end, after you pick someone up that's in a mental health crisis, where do you take them? So we have to build out on the back end, and we have to build the talent on the front end to actually provide those resources. Steve, I'll just leave you with this quick thought. I don't live too far from a substation. They've got about 30 cars. For every 30 police patrol cars, for every 5, wouldn't it be wonderful to have one mobile crisis unit that is staffed with a triage team of a behavioral health expert, a peer specialist, and to be able to go out on that call and to pick that person up safely and to take them somewhere where they can get the care that they could absolutely benefit from. So that's what 988 is for us. And the need is for us to really realize that it's going to take all of us talking about it and marshaling the resources to make it a reality.
Dan, thank you for setting the stage for us. Dr. David Filene, you're a man of science and a man of scientific practice. And I'm just interested in what science tells us that we most need. As you look at this, we've been having, I think, a really great set of conversations today with really, really well-meaning people. And I guess one of these people where I love earnest folks who want to make the world better. But I'm wondering if there's a bank shot in this, if there's some unexpected dimension that could help actually, help us strategically jump into a much better situation. Or am I naive? Is this all going to be incremental, step-by-step process? What does science tell us?
Thank you, Steve, and I appreciate the Hill for your attention to this and the Hartford for sponsoring this work. I'm actually a primary care physician. I do have a specialty in addiction medicine, and at some level, I see primary care as the de facto mental health and substance use disorder treatment system that we have at this point. And so if we can provide resources to the frontline providers in primary care, invest in workforce education, and quite frankly, I think science has told us what we need to do, and we have effective interventions. The limitation is implementation of those effective interventions at the frontline resource. And quite frankly, I think we would go a far way to address stigma by addressing it more directly where patients feel comfortable: primary care, hospital, OBGYN clinic, pediatricians' offices. Those offices need support. The providers need education, but those offices need support. And so, if anything, science has advanced to the point where we have effective interventions. It's now on us to implement them with haste.
Before I jump to Courtney and to my friend Jim, David, I just want to ask you another question. I want you to grade the literacy of Americans in the aggregate on how they deal with folks suffering from mental health. I would give them a very low grade. I want it to be higher, but I'm a realist. I want to know, National Council of Behavioral Health has tried to do mental health first aid and spread that around the country. I know that Dan Gillison is working so hard with the National Alliance on Mental Illness, but it just seems to me whenever I see a case out there in real life, I see everybody I thought would be humane and empathetic and sorted out run the other way, and I'm just wondering, what do we have to do to turn that around so we not only get empathy at that moment, but we get kindness and we get, the right sorts of interactions to help that person in need and crisis?
Yeah, Steve, that's a great point. I think for a long time, traditionally, we viewed mental health and substance use disorders as weaknesses of the will and moral failings. And the science of addiction and the science of mental health has really exposed the extent to which there are not only genetic, environmental, but basically neurobiologic changes that explain the behaviors that we see. And in the same way that we've demystified areas in cardiac disease, in cancer, I think we need to be able to demystify these issues in patients who have mental health and substance use disorders. Because what you said at the outset of this program, that we all have this in our family, we all know somebody who's impacted by this, and we all know those people to be good people, and they just have a condition that needs to be recognized and treated appropriately.
Well, thank you for that. Courtney, you just got, Shatterproof just got mentioned by Chris Swift. I guess I'd like to know how you folks work. We're talking a little bit about workplace stigma. That means that folks in the workplace are aware that there are some people with these challenges, and you've kind of helped put together a toolbox, a toolkit, a pathway, a pattern set of responses that help employers help their people manage this and to create healthy workplaces. So how do you do what you're doing? Without giving away your trade secrets.
They're not trade secrets at all, Steve. And thank you so much for including Shatterproof in this event. And thank you to the Hartford. We know that in the last year during the pandemic, fatal drug overdoses have increased by 30%. that is drastic, and it should be a call to action for everyone in this country. At Shatterproof, we are dedicated to reversing the addiction crisis. We're a national nonprofit that's focused on increasing the quality in addiction treatment, reducing those barriers to addiction treatment, educating families and loved ones so they know where to turn when this hits home, and really eradicating stigma, as this has kind of been the topic so far, during this conversation. And it is pervasive. It prevents most people from getting treatment. It exists in our families, and we don't really want to know somebody or work with someone, right, who's struggling with addiction, and that has to change. And I will also mention that as we have this conversation about mental health, so often mental health and addiction are, comorbid. They live together, and we need to be treating them together and not in silos, and really bringing them into the medical mainstream and looking at behavioral health disorders and not just addiction and mental health. But these are disorders of the brain. And as Dr. Phelan, pointed out, we need to be arming our medical providers and practitioners with the right tools to screen, because right now, not everyone wants to screen because they don't know where to send their patients. They're not equipped with the resources and the data and the time to help folks. And that's really, as he mentioned, the frontline providers are key in that. And at Shatterproof, on the policy side, we're working a lot to integrate behavioral health services into the primary care setting through something called the collaborative care model. And making sure that our Medicaid agencies are covering that and understand the importance of that within primary care, particularly as so many folks have lost their jobs this year and have gone on Medicaid. Medicaid is of utmost importance as well, in addition to private insurance. So I say all of that to say there's no secret sauce. There's no silver bullet to solving this crisis. These problems and barriers to treatment existed before the pandemic, and they were exacerbated by the pandemic. And so we need to double down on what we know, what works, but we also need to be innovative. We need new research, but we also need urgency. And so I'm just so grateful for all of us working together on this. And we know that this is a treatable illness, and that people do recover. And I think that's really important as we see all of these headlines around, the fatal overdose numbers, that people understand that you're not alone. There's treatment available, and treatment works. And we have, 23 million Americans that are living in recovery every day. So I'll leave you with that.
No, I mean, I think it's very powerful what you said. And look, I mean, the Hill in my time here in the last couple of years has made this topic a priority. This is not the first one. We've kind of come around many times. And, Senator Debbie Stabenow, I talked to a few weeks ago, has done a lot with Roy Blunt and others to sort of elevate the questions of broad mental illness resources. But one of the big questions, I'm going to throw this all to Jim Carroll in a minute, but there's an economics of this too, where you look at hospital centers, you look at states. Part of it is money, and we kind of think, well, there's going to be money provided, but it's getting, what does wellness mean if mental health is not built into a health system, or if it is and it's just the orphan child on the the left. So there are a lot of alignment issues when it comes to how do you get gravity moving in the right direction so it reinforces support of that person who is having challenges. So Jim, I mean, I want to come to you, and if you heard John Katko earlier, he cares about this issue deeply. David Hayes, Senator Stabenow, others across party lines, and people credit your work with helping to get a decrease in those that had died from opioid addiction, trying to make a dent in this, and then the pandemic hit. And I would just like to say to you, so first of all, thanks for that. And what are the key pieces of this puzzle that would help us understand from a policy perspective what we need to wrestle with?
Well, first off, Steve, thank you so much for having me on. But more importantly, thank you for continuing to push this message. All of us are experts. All of us understand the issue, but you give us a voice And therefore, the key policymakers, the key lawmakers that are participating and watch your show, Watch the Hill, are able to really be influenced by it. And that's what's critical. And Courtney just said it. Right now, time is of the essence. And there are going to be some scientific breakthroughs. I do believe that. But I also think while we do that, we also need to take advantage of some of the technology that is out there and push for some of those changes to happen as well. And we're talking about reaching some of the most vulnerable people. That starts really at a very young age. And we have to be able to recognize that the year that so many kids missed from school has really had a detrimental impact on not only their mental health, but also on the messaging they get, the prevention education they get from folks like Shatterproof, from SAD, and from others, where they learn the techniques from their peers to be able to say, no, I don't want to try this or try that. And so that has been important. But also, as we look back over the last 15 or 16 months of the pandemic, we estimate that 100,000 people died of a fatal overdose. Those are just horrific numbers. And we need to stand up and make a voice, just like you're doing, Steve, for those people who so desperately need it. And that is the purpose of having this, to make sure that people understand that stigma is real and we have to fight it. And it really, not only does it need to take place at the workplace, but it starts at home. And it starts to recognize that our family members are the ones that we can see closest usually, and that they're the ones that we can get hope and help to the most.
Let me just ask you all, and let's go to Dan, Jim, Courtney. One of the things that struck me as I was preparing for today that I just didn't know is when Congressman Katko talked about, for every person who unfortunately succeeds at suicide, there are 29 other attempts. If you look at the Trevor Project and young LGBT youth, 40% in this last year ideated or thought about suicide. And of course, I understand there are workplace stresses and other issues. And what does a workplace mean anymore in a COVID area where you're not in touch with everybody in your workplace, but you're online or you're at home, whatever. I'm just, interested, Dan, do you have any kind of thoughts on how we navigate that? What do we do with young people who I guess don't have the support and hope about their future wherever they may be? It just really struck me today preparing for this, and just wondering what you and your members and the folks you work with are advising, parents, friends, teachers, folks out there with contact with young people, because that number is huge.
It is huge, Steve. And one of the things that we experienced last year is we have a helpline. And that helpline, we saw our numbers go up by 65%. And many times those were parents calling, looking for resources, looking for ideas. So one of the things that we try to do is connect them with resources. And what our young people really want is they're looking for, you mentioned empathy. So it starts, you mentioned empathy at the very beginning of this. So that's one of the things they're looking for. And the other thing that really was compromised last year was hope. All of our young people are looking for that hope. Then we can get into the science of the solutions. But from just the practical standpoint, our young people are trying to navigate something that all of us have never experienced, which is this isolation and a different kind of environment that is uncertain and has all of this doubt. So we begin with trying to provide resources through our helpline. And what we recognize is that when we talk to parents, what's so interesting is the two things that we see when we speak to parents, that's the common denominators, are fear and lack of hope. And that's what we try to bring back to them by sharing with them some resources that they can access that can help them. And we also have programs that we provide for schools and for educators that are touching the young people. So we're trying to do a number of things, but that's where it starts for us from the standpoint of really speaking to the young people as well as the parents.
Thank you. Courtney, can I get a quick answer from you? Then I'm going to take a question from the audience for our other guests, but jump in, Courtney.
I'm not good at quick answers, but I will try. That was really stunning what Dan just shared in terms of, hope and lack of hope and fear being very pervasive. And I think that goes hand in hand with stigma. What we need to do to eradicate stigma is to tell stories. And to connect people with resources so that those stories aren't being told in isolation, but that when somebody has a moment of desperation, the tools are there. So as Dan mentioned, the helpline, the 988 number, critically important. But also we need to make sure that on the addiction treatment side, when someone is ready to go to treatment, that they're not being preyed upon because they're going to Google and typing in detox near me or rehab near me. And they're thinking that for themselves or for a loved one, most often for a child, that your child needs inpatient 30-day treatment. And that might not be the case. So at Shatterproof, we're working on quality metrics through our Atlas program and connecting treatment providers and patients with quality treatment and trying to bring those standards up to the medical mainstream. So critically important. And then all of the educational efforts that the Hartford is doing by connecting employees to actual resources through our Just 5 program.
Well, thank you. We have an audience question from Keith Renshaw. Keith?
My name's Keith Renshaw. I'm a licensed clinical psychologist and a professor and chair of the psychology department here at George Mason University, just outside DC in Fairfax, Virginia. My question is this: are you aware of any existing or planned scalable models of stepped mental health care with easy entry points that are embedded into widely accessible prevention work to help reduce stigma and increase accessibility, possibly in combination with follow-up stepped care that could better address the broad needs?
Let me go to David Feline and then Jim Carroll. David?
That's a wonderful question. And, stepped care is the idea that you start with perhaps a low barrier and a low intense level of treatment. And based on the patient's response, you increase the intensity of the services and the medications and counseling that the patient receives, because not everybody needs the same level of treatment. There's no sort of cookie cutter that everybody requires an intense level. And so to the question, there are emerging programs that are starting to integrate medication initiation, for instance, buprenorphine, in prevention programs, so syringe service programs. We have a program in New London, Connecticut, where we partner with a syringe service program and we initiate treatment and we provide a linkage for that patient to get into formal addiction treatment at an opioid treatment program. And so we do need to investigate low barrier programs, quote unquote, meeting patients where they are, and then increase the intensity of services based on what the patient is interested in and based on their clinical response, the way we do in all other medical conditions.
Thank you for that. Jim Carroll, I'm interested both in your answer to his question, but also, do we need to do something? One of the things come up with regards to opioids is that we don't have the infrastructure in place so that first responders and others that need to provide, Narcan or others, that infrastructure is not there. Is that right or wrong? Jim?
Well, first off, in terms of the stepped care, we certainly have seen some cities where they have a central hub, a central place where people are brought when they're suffering from either a mental health illness or in conjunction with an addiction illness. And thereby going to a central hub, the idea is that they then can put them in a facility or get them the treatment that is most appropriate, but also immediately available. And so these hub and spoke type models, I do think, are the future for a lot of facilities and for a lot of communities so that they can get care, especially to some of our communities that have been historically underserved. In terms of our first responders, there's a lot of law enforcement groups that are desperately trying to understand addiction. They already understand that incarceration is the last thing that is helpful. It does not do a single bit of good. And so one of the things that a lot of the law enforcement are doing now, in particular, the International Association of Chiefs of Police, is working with communities, local law enforcement, and teaching them de-escalation techniques for free, for dealing with people who are in the midst of an overdose or in the midst of a mental health issue. And so they're teaching them de-escalation techniques, but also they are carrying naloxone. And thankfully, more and more people have naloxone. I carry it. Everyone should learn how to use it and have that on them. And there's also more powerful versions of naloxone coming out, really to address fentanyl overdoses, which are the leading cause of these fatal opioid overdoses right now.
Well, thank you. Dan, I just sort of feel, with NAMI, National Association of Mental Illness, I want to give you like the last 15 seconds. If you wanted to tell people out there that are lay people who don't know about this, how they can help, what they can do, what would that be?
It would be to connect with the resources that NAMI has at NAMI.org, or to reach out to us on info@NAMI.org. And also our helpline is at 1-800-950-6264. And also say to ask your leaders in your community about 988. Ask your elected officials, where do they stand on 988? Do they know about 988? We don't see it as the panacea, but we see it as a part of the transformation of mental health care and mental health resources. And I would also say that when you ask about youth, we see the pain and the suffering that many of our youth are dealing with. So we are building out a youth and young adult task force. We also have a very robust ambassador program because, if I see someone who looks like me, I am more interested in hearing what they have to say. So our youth and young adults program is very good. And it will take all of us. And I think that this is a good example of us coming together and building this tapestry of working together.
Well, thank you. Well, we've got Congresswoman Johanna Hayes up next, but I'm going to thank Dan Gillison, the CEO of National Association of Mental Illness, Courtney Hunter, Vice President, State Policy for Shatterproof, David Feline, Professor of Medicine, Emergency Medicine, and Public Health at the Yale Program in Addiction Medicine, and Jim Carroll, co-founder of DC Consulting and the former director of the Office of National Drug Control Policy. I really appreciate all of you for joining us today. Thank you.
Thank you.
My next guest is Congresswoman Johanna Hayes of Connecticut, a member of the Youth Suicide and Mental Health Task Force on Congressional Black Caucus. She also serves as vice chair of the Labor Caucus. Congresswoman, it's great to have you on this. I'm going to ask you maybe an unfair cosmic question. When we look at the surge in mental health challenges and opioid addictions and suicides that are going on in this country right now, what is America not getting right in this moment that we have to fix to help people where they are?
That this is not, first of all, thank you so much for having me. But when we talk about mental health and addiction and suicide, those are not single issue conversations. We also have to address all of the intersections and the core issues that lead people into these types of circumstances. So we can't talk about suicide and addiction without talking about housing and healthcare and nutrition and all of the stressors and the underlying factors that create this ripe, fertile ground for people to become susceptible to those types of things.
When we look at the fact that now we seem to be making our way to the other side after the pandemic, and we know that the pandemic did not hit everyone equally in this country, that there were communities that were very hard, disproportionate, and they may still have hangover from that. We've seen it on the economic front. Do you have hope when we kind of talk about all those other systems that that's beginning to kind of level out for people?
I do have hope because we are at least having those conversations. I mean, when we are looking at funding for the CDC, we recognize that we have to talk about chronic health conditions. When we are talking about returning kids to school, we have to have trauma-informed counselors and care. So the fact that we are having those conversations, even though it resulted out of a pandemic, I think is very hopeful. You know, at the beginning of this crisis, we didn't even have full access to telehealth or for people to be able to reach out and address people in those ways. So the pandemic did have, while there were lots of things that were horrible about it, there are so many lessons that we can carry forth to make the delivery of these services to the people who need them the most a lot more affordable and a lot more accessible.
When it comes to the legislative agenda, now in this show and today we're talking to someone that you've been working with a bit, Congressman John Katko, a Republican of New York, and he signed on to some legislation that has passed in a Democratic-controlled Congress. I'm just interested in, legislatively, when you look at both what's passed and what the horizon is, what is on your agenda being most important?
Well, I look at, I think the holistic viewpoint, just funding these programs is not enough. I'm very concerned about the impact that addiction has on our youth. So making sure that we have those wraparound services in schools. I introduced legislation to save education jobs to make sure that as districts are thinking about their next steps, they are not cutting social workers and guidance counselors and therapists, all of those people who deliver services on the ground at school, that for many of our young people, that's the only place they're getting them. I introduced legislation to make sure that we are increasing funding on college campuses to make sure that there is access to addiction and recovery services. Just making sure that those things are available in our communities. I think oftentimes when we think about addiction or mental health, we think about just the person or the person that is affected. I want to make sure that we are also addressing the needs of the families and children that are affected by addiction, by mental health, by recovery. All of those people who showed up in my classroom and quite frankly, were me as a young girl. So I want to make sure that we're looking at this in a very holistic way to address the needs of our young people and the people who are impacted as a result of a family member or a loved one being dependent. And also, I think equally as important, to make sure that we are legislating in a way that recognizes that addiction and mental health are health issues. Those are medical issues that we have to address just as we would any other health condition.
Congressman, let me ask you a question. I'm not sure I'm going to get it out right, but it's sort of been on my mind. This is Pride Month. We have lesbian, gay, bisexual, transgendered, often young people, sometimes community of color. Mental health is also, a challenge for some people as they find themselves and declare themselves come out. I've talked to folks from the Trevor Project, about the aid and assistance that they've tried to give people in these communities. And I know there are many other communities out there. You've been dealing with the VA. But as we saw with the pandemic, we needed ambassadors that people trusted to reach them. We needed folks in this. And I'm just wondering, as we think about this at the federal level, do we have the right partners? Do you have any thoughts or insights on how we can reach people where they are?
I think that's a great question. And you're right, we do not have the right partners because part of this is about relationship building. I'll give you a perfect example. I now chair the Subcommittee on Nutrition Oversight and Departmental Operations. And myself and Congressman McGovern are calling for a White House conference on hunger. But it's not just with the medical and the legislative professionals in this area, but it's schools and faith-based leaders and community partners and people who are the recipients of benefits, all of those people who have a very different perspective on this very important conversation. And I think we have to take that same approach with anything that we're having. You are not going to send, a straight person into the community, the LGBTQ community, to be a validator and to talk about the importance and the needs of some of these programs, or even to know who to speak to or how to speak to them. We need people from within the community to be the ones that are at the table, leaders in their field, gaining the information, and then bringing that information back to their respective communities. And that has to happen across the board. Actually, we have legislation right now to diversify the medical profession, to make sure that we are offering scholarships and opportunities for young people from various communities to consider a profession in healthcare so that they too can in turn infuse that pipeline and be the person in these communities that may have cultural barriers or language barriers or religious barriers or things that an outsider just wouldn't understand. So all of that is important as we move beyond this pandemic and make sure we are giving people exactly what they need to rebuild their families and be healthy in their communities.
Thank you for that. Congresswoman, you have also, I'm going to get in one more question before we go to an audience question in, but I'm really fascinated by these different communities, and you've touched so many of them in your time in Congress, but you sponsored legislation, the Bipartisan VA Mental Health Staffing Act, the VA Mental Health Counseling Act, and I just, as I asked Congressman Katko, has he interacted with Secretary Dennis McDonough? Do you see the VA under Secretary McDonough, the Biden administration, the folks at HHS, putting enough priority right now on mental health? I know there's a lot on their plate, but the question is, are the priorities where they are? You just asked for a White House conference. Are there other things like that we should be doing and expecting the administration to pull behind, particularly with veterans?
Well, veterans is a priority area of focus for me. I have so many veterans in my community. But to your point, to answer your question, I don't think that it's all in the White House. I think that we as legislators and community members also have a responsibility. Public sentiment is everything. I had to educate myself very quickly on the needs of the veteran community. And I did that by listening, by reaching out, by engaging with stakeholders, with veterans, and asking them what they needed, and then going back to Washington and using my agency and my capacity to write bills to close those gaps and address their needs. And I think now we'll do the same thing with this current administration. As I'm hearing from my constituents, I will elevate it up the chain to remind them that first, not only do we have a moral responsibility, but we have an obligation to provide these services for people who have, in many cases, made the ultimate sacrifice for our country. So this is an area, I went to Congress as a classroom teacher, so education, labor, some of those things were a lot more just familiar to me. The veteran space is an area that I had to familiarize myself on, and I did that by listening and learning. And I think every elected official has to do the same thing, especially out of the agency that directs Veterans Affairs. So I will make sure that I will continue to elevate these things. Back in March, I visited a VA hospital, and I heard from many of my constituents that their spouses could not get vaccinated, and they were just concerned about that. Many of them were the caregivers. We were able to quickly draft legislation, and within the space of, I think, probably 2 or 3 weeks, the president signed it into law. So they are listening. They are listening to us. We are listening to our constituents, and I am hopeful that this will be a priority, especially in this administration, because the President Biden, really has a deep understanding and appreciation for our service members and their families.
We have a question for you from our audience. Ryan?
Hi, my name is Ryan Greenstein, and I'm the Legislative Director for the National Association of Attorneys General. My question for today's panelists is, with a new administration and a new Congress, what are the prospects for Congress this year eliminating the DEA-X waiver in an attempt to increase access to medication for opioid use disorder through legislation such as the Mainstreaming Addiction Treatment Act?
Well, thank you for that. So the question is really, I think, an important one. What can we do at the federal level on providing, at least the pharmacological response to some of the addiction challenges we have in the nation?
I think we tried, and actually this has always been a priority. This isn't new. In the 116th Congress, our very first HR 3 was a bill that had to do with lowering the cost of prescription drugs and just, reshaping our relationships with the pharmaceutical industry. So that has always been a top priority. I think there is more of a chance for that legislation to move, and similar legislation in this administration, because we have an administration that is listening, that wants to make sure that while we are addressing, the research, the development, that part of the pharmaceutical industry, we're also addressing the part that directly affects patients, and that is the cost of prescription drugs, the accessibility, the affordability of those things. So we have remained, our foot is still on the gas on that issue. And I think that everyone has a different level of urgency coming on the other side of this pandemic. So I really am hopeful that we will see progress in that area, especially.
And just a quick follow-up on this. Does this DEA-X waiver issue come up in discussions when you're with your caucus?
It has not. I think the specific issues like this, and I think that's the great thing about being in this role, oftentimes state or constituents or panels, questions like this bring things to my attention, and then I can in turn bring them back to the caucus. This has happened on so many other issues. At the beginning of the pandemic, when we passed the original CARES Act, I heard from so many small businesses that the very small businesses didn't have access to some of these loans. We were able to take that information back to caucus and make sure we addressed it. So this is very similar, where it's not something that had come up, but the fact that it's brought up today in this panel gives me the opportunity now to just be the facilitator for this conversation within our caucus.
Congressman, I'm going to sneak in one last one. I'm just really interested in the time. You know, I spent time in Congress. Of course, you're there. You know, this is an area in which there's been bipartisan support. Do you think there are human moments and human needs like this, where people come together in the legislative branch of government, they get to know one another, and they actually see themselves as people dealing with real people problems? Should we have any hope that the toxicity in this town may decline by you having more success on this front?
Well, I can tell you, I came to Congress from the classroom, and never in my life have I first been identified by my political party, the D behind my name. I never dealt with people like that. I never had that expectation of people. So that was very jarring for me when I first came to Congress, the political divide. A lot of this for me, well, for every one of us, should not be about politics. It's about policy. And the thing that I would say is no one can say, I think there's an irony in it when people in Congress say, oh, well, this was their position 5 years ago, and now they've reversed course or they changed. You should change as you're in this role. As you are hearing from people and learning what their challenges are and recognizing and appreciating what we can do to help them, your position on all of these things should evolve. And I don't think anybody is the same as they were a year and a half ago. This pandemic has just revealed so many gaps and so many inequities and so many challenges. And many of these stories are heart-wrenching. And I think as legislators, we have the ability to change a lot of that. So I remain ever hopeful. We continue to try. I just actually introduced legislation with my Republican ranking member on my committee to make sure that we are extending school meals to kids in foster care and being raised by grandparents. That's a major step to get, you know, my counterpart on this committee. We agree that kids should eat. And we had to sit down and work together on what that looked like and the things that we would agree to, but we were able to do that. So I can assure you that I will continue to do my part in that area and really just appeal to my counterparts, my Republican counterparts, to do the same, because their constituents are hurting in the same way that mine are. And there are so many things that we can do together.
Well, Representative Jahana Hayes of Connecticut, member of the Youth Suicide and Mental Health Task Force in the Congressional Black Caucus and Vice Chair of the Labor Caucus, such a pleasure to talk to you today. Thank you very much, and I hope you will come back and talk many more times with the Hill.
Thank you.
That brings us to the end of our program today. A big thank you to the Hartford for its support and to all of you attendees for joining these very important conversations. For any of you who missed these conversations, we're going to have the video up from the event on our website shortly. I'm Steve Clemens. Be well.